good. So good morning, everyone. This is Commissioner Yamamoto. Today is Tuesday, March 29, 2022, and we will call this meeting to order at 8 a.m. sharp. So before we get started, I'd like to remind everyone to please mute your phones. You can do this by pressing *6. Please unmute yourself when called to speak, again, pressing *6. It is very important for all others to remain muted. Thank you. So welcome to the Board of Commissioners community call, weekly community call on Tuesday morning. Let's do Commissioner's roll call. I can say that Commissioner Bell is not able to join us this morning. So Commissioner Scar, are you available?
Good morning, I'm here.
Good morning. So I appreciate everyone being here this morning. Let's just jump right into the agenda and go to Adventist Health with Eric Swanson. Eric, are you with us?
I am. Good morning, Commissioner.
Good morning.
Hey, we have 14 patients in the hospital today, plus one brand new baby. 0 COVID patients, 0 patients boarding in the emergency department. Surgery's got a super busy day today. 15 surgery cases scheduled. 13 are elective or non-urgent. Our ambulance did 12 911 transports yesterday, no transfers or transports home. The number of hospitalized patients with COVID-19 across Oregon is 118, 15 fewer than yesterday. There are 19 COVID-19 patients in intensive care unit beds, which is 3 more than yesterday. 8 of those patients are on ventilators, 873 ventilators available across Oregon today. There are 140 available adult ICU beds out of 672 in the state, which is 21% availability. In Region 1, we have 61 beds being available, which is 18% availability, and 444 available adult non-ICU beds out of 4,251, or 10% availability for the state, and in the region, we're at 7% with 133 available beds. Our March 25th COVID report from Dr. Peter Graven at OHSU showed that as of the 25th, there were 157 people hospitalized with COVID-19. And in Oregon, all regions are below the statewide threshold for hospitalizations. And across the U.S., all regions are back to hospitalized patient levels that existed prior to the Omicron surge. And there's little variance between the various regions of the U.S. Pediatric census level in Oregon for confirmed positive patients under 18 was 4 last week, which is great. The 5% of occupied ICU beds are filled with COVID patients, which is down from 9% 2 weeks ago. So things continue to trend the correct direction for hospitalizations. The new Omicron variant, he is reporting that a drop in prevention behaviors are expected to lead to an increase in hospitalizations. However, that increase is expected to be mild because a large portion of the population has some immunity because of vaccination or a prior infection. A couple other things I want to remind you of. We still have masks requirement for healthcare facilities. So if you come into the hospital or any of our clinics, we'll be asking you to make sure that you put on a mask for us. Let's see. The other thing I wanted to share with all of you is we've been working really hard to fix our phone answering issues and get our phones answered in a timely manner. So I have a couple slides that I'm looking at right now that came from yesterday's report. Our goal is to have less than 5% of our calls abandoned, or meaning that people hang up because they're tired of waiting. And our 5% threshold, we've been meeting that for the last 6 weeks. So yesterday's report, we're about 3% of our calls are being hung up on, which we're really happy about. We don't want any hang-up calls, but we are happy with the less than 5% target right now. And our wait time goal is less than 20 seconds. And for the last month or so, we've been meeting that target as well. So we'll continue to work on getting our phones answered in a timely manner. We've implemented new processes for that. So it also might be helpful for the listeners to know that our next project that we're working on is scheduling. How do we get people scheduled in a more timely manner and much more efficient? And hopefully I'll have some good data to report to you in the future about that. So unless you have questions for me, that's all I've got for you.
Thank you for that, Eric. Do we have any questions for Eric? Eric, just a couple of observations. And all three commissioners are part of your civic advisory board at Adventist Health Tillamook, and we appreciate that very much. And I know this was one of the issues that we talked about at the last meeting was your phone system, and I love the direction it's going. I mean, that's a great move that you're making, and I, for one, appreciate it very much. One other thing that I just want to throw at you. I mean, I continue to watch the daily reports that we get from the state. And I think even over the weekend, I mean, there were less than 200 cases reported, I believe. And I'm doing this from memory, and my memory is certainly not as good as it used to be. I know it was less than 200 cases across Oregon for the weekend, and yet Tillamook County had 5 cases reported. Is that concerning to you at all?
Well, I guess not in the big picture. I'm not so worried about it because I'm looking at the report that came yesterday from the state, and we are, Tillamook County actually is we're the 4th lowest case count per 100,000 in the state.
Okay.
And we also have a pretty high vaccination rate. As of today, the state is reporting that our vaccination rate for Tillamook County is 80.6%. So we're in the top. Last week when I reported this, last week we were number 8 in the state for vaccinations. So I'm of Oregon's 36 counties. And our test positivity rate, the state's saying, is about 4.6%, which is less than the top one was Jefferson County at 5.6. So at this point, I'm not too worried about it. And just anecdotally, we are not seeing a lot of people come in that are sick. There's a difference between a positive COVID test and being sick with the disease. And we're just not seeing sick people. People are having those positive tests. One of my friends has a family member that just had a positive test, and my first question is he sick? And he is not sick. He just has a positive test. So that's kind of the difference. Are you positive, or are you positive and sick? And we don't want people to be sick. So that's the position that I take. And I am not the expert, but that's just kind of the way I look at the data.
Thank you so much for that, Eric. I appreciate it. Any other questions for Eric?
Eric, David Gomberg here. Good morning, and thank you for the positive news. I'm sure we're all pleased to hear numbers trending in a constructive direction. My question is that the reports that you provide are based on the home address of whoever's doing the reporting. Put that in the context of all the visitors that we're seeing, particularly during spring break and with the summer approaching. Does that vary our concern results in Tillamook and the Central Coast?
Sure. I mean, when we have, so I can just kind of anecdotally talk about Tillamook's population. What do we've got? 26,000 full-time residents. And then on a holiday weekend, and I don't know how we were with spring break, but on a holiday weekend, we estimate that we surge up to 100,000, quote, residents. So anytime we have more people in our community, there's more opportunity for exposure, spread, and exposure to different types of bugs. And so it is a concern when you have more people. And so some of those folks may go home and test positive, and they've been in Tillamook County all week for spring break. The other thing I think we need to be very aware of is that if you have a home test, you take your test at home, it doesn't get reported into this database. So we're underreporting the number of positive cases. And that's why I really look at, are people sick and being hospitalized in the emergency department, coming to urgent care, sick with the disease as opposed to positive, because we know the numbers are underreported. I was over at the urgent care this weekend, and I saw stacks of COVID tests that were just given away free to people to take home if they need a home COVID test. So the numbers are definitely underreported. But again, I'm looking at how many people are sick, how many people are hospitalized.
Thank you for that, Eric, and thank you for that question, Representative Gomberg. I just want to make one more observation for everyone out there. So the mask mandates generally have kind of been relaxed and gone away, and everyone is trying to get back to normal, which is a great thing. But there are still instances where colds are starting to rise, and even the flu is starting to rise. So I just want to remind everyone that if you are not feeling well, I know in the past it's always been a problem. I got to go to work. I got to get these things done. But honestly, if you are not feeling well, please stay home because we don't know exactly what it might be. And it's just important, I think, that we take care of not only ourselves and our families, but everyone else in the community. So again, if you're not feeling well, and you, especially if you really don't know what it is, please stay home. That's the best advice I think that I can pass around. So I'm hoping everyone will take that to heart.
Mr. Chair, may I make a couple of comments?
Yes, please.
So I, as Commissioner Scar, I had a couple people that were asking me, when will you guys stop reporting those numbers? We're tired of listening to numbers. COVID's on its way out. Stop talking about it. And, I just want to really let people know that part of the reason we keep talking about it is that we don't know for sure if it's on its way out. We know we're having a wonderful trend downward. We're all super happy about that. We feel good about that. And we don't want to take our eye off the ball too soon. We all know what happened last year in June. Everyone got super excited. Masks went away. And of course, the Delta variant came swinging in out of nowhere and very quickly increased our numbers, not only of cases, but of hospitalizations. So we understand that there is definitely a lot of COVID fatigue and that people tune out during these numbers and they say, oh, why are we still talking about it? We're still talking about it because it's not gone. And we need to keep our eye on this ball long enough to feel very confident that those numbers are not going to unexpectedly trend upward. So we invite you to celebrate with us. Listen to the numbers. Celebrate as we continue on a downward trend. So thank you.
Thank you for that, Commissioner Scar. Appreciate it very much. And any other comments, questions? Again, thank you so much, Eric, for being here this morning.
You're welcome.
Let's move on to the Coastal Caucus. I know Representative Gomberg is here, and I don't know who else might be on the line.
Well, good morning, Commissioners, again. Do we have any senators with us this morning? I am not hearing any, and I got a call earlier this morning from Representative Weber that she has a conflict, so I fear that I may be the Coastal Caucus this morning for all of you.
Hey, you are it.
Well, which is a good opportunity, Commissioner, for me to remind folks about the change which is underway with the legislative district boundaries for both representative and senatorial districts. Folks are going to be, they're going to be getting their election ballot in about a month. And while Tillamook County currently is divided between 2 House and 2 Senate districts, with the election in May, we will only be casting ballots for 1 House district and 1 Senate district, as Tillamook County has again been consolidated, as it was 10 years ago, the last time we redistricted. And Senator Anderson and Representative Gomberg will continue to represent the south part of Tillamook County until next January, but the elections that we hold between now and January will focus on the new boundaries, not the old boundaries. And I know that's confusing to folks. So the short answer is you're not rid of me yet. I'm very pleased to be with all of you this morning. I did speak with Representative Weber this morning. She sends her regrets, but she also wanted to remind everybody that there is a Safety on 6 town hall coming up. As I understand it, this will be a Facebook town hall, and you can find out more about it on the Safety on 6 webpage to get more information about what's going on to try and increase safety levels on that still sadly dangerous stretch of highway, and how you can be involved, what the newest steps are going on there. That's what Representative Weber wanted me to share with you, and I'm sure she'll have more details for you next Tuesday morning. I wanted to talk with the time that I've got about child care. And we all, of course, understand the role that child care plays in the lives of the families of Tillamook County, but also the economy of Tillamook County, because what we are seeing is that that we've got a lack of affordable housing, and we've got a lack of available and affordable child care. And cumulatively, that adds to our problem of not being able to find enough workers for the jobs that are out there. I talk to families all the time that are looking for child care, and they can't find it. And when they can't find it, they can't afford it. One of the aspects of all of this is that people were staying home during COVID and taking care of their kids while the schools were closed, and kind of got into that lifestyle adjustment. And now that the schools are open again, some kids are still staying home with their parents. And wouldn't it be helpful if, in addition to taking care of their own kids, if a few of those homes were opened up and were able to take care of other children as well? I mean, you could make an opportunity available for some folks to return to the workforce. You'd provide a socializing opportunity for your own children as they've got other kids to spend time with. And oh, by the way, starting that new enterprise, for every child you add to your household could bring in another $500 a month. So 3 kids could add $1,500 a month to your family income portfolio. One of the real challenges in making that seemingly simple solution available, particularly here on the Central Coast, was a regulation that required that any time we have in-home child care, that home be equipped with overhead sprinklers. Now, I'll pause for a second and let you contemplate what it would cost to install overhead sprinklers in your house. Easily $10,000, which is going to stop anybody from considering the option of bringing some extra kids in and taking care of them during the day. And I'm sure some people are sitting back listening today and saying, well, wait a minute, Gomberg, we want those overhead sprinklers. We want to keep our kids safe. And of course we do. Although I'd remind you that overhead sprinklers are more designed to protect property than they are to protect people. And so what we did is went in and talked to the regulatory agency and then facilitated some changes. So they're looking at not requiring those sprinklers if there are other safety protocols in place. For example, that the child care program would be on the main floor, not downstairs in a basement or up on a second floor. That there is easy access to exits, that there's nothing between where the kids are and where the exit is, like a stove or an oven or a fireplace. A number of safety protocols, and if you can meet those safety protocols, then you can provide that child care. I think the other question that people might be asking is, gosh, if I were interested in operating a child care program in my own home, how would I do that? I mean, what are the rules? What are the regulations? How do I deal with insurance? And do I need to create a business? What about first aid training and other safety protocols? And I'm pleased to see that at the Oregon Coast Community College in Lincoln County, the Small Business Development Center is now offering a program, a 4-part program for people interested in providing child care. And I think that would be open to any programs on the Central Coast, not just residents of Lincoln County. And it's a 4-part program that covers those things that I just mentioned, including the first aid training. The cost of that is $25. And if you complete all 4 parts of the program, including the first aid training, you get the $25 back. I think there's a great opportunity here for us to expand the service that we sorely need here on the Central Coast. Child care, help get people back to work, help take care of our kids, help secure the working and family lives of people that live here. So I'm pleased to see that opportunity becoming at least more accessible to folks that live here. That's the main thing I wanted to share with you, commissioners, and I'd be happy to pause at this point, see if anybody's got questions about that or anything else that may be going on now that the legislative session has adjourned and that we're moving into the interim period.
Anybody have questions? So Representative Gomberg, I just have to say that the story behind the story here about child care and how you have to manipulate things in order to, I agree with you 100%. Do we want kids safe? They have to be safe in child care. Do we have to require that someone wanting to operate a child care center in their home put in sprinklers? I think the issues that you brought up and placed in the bill, I think that makes a lot of sense. So again, I appreciate that very much. And I think perhaps Commissioner Scar wants to weigh in, please.
Of course I do, Mr. Chair. Thank you. Child care is one of the things near and dear to my heart, and I really appreciate Representative Gomberg's work recognizing that home child care providers provide, I mean, it's just a crucial piece of the system. We have some center providers that are also a crucial piece of the system, but home child care is one of the easiest ways to expand child care right now in the world that we're working in, as Representative Gomberg reflected. And I wanted to talk quickly about something happening here in Tillamook County, and it's actually happening across the state, and that is the implementation of a model called shared services, which is supportive of home child care programs getting started. And ours is being offered through our Child Care Resource and Referral Program, which is under the Regional Education Services District. And Eva Manderson is the lead on this project. It is an opportunity for someone who says, I would like to do that in my home, and I'm not sure how to get started, exactly what Representative Gomberg was talking about. And this is a program that helps them put together a website. It helps them put together a billing system. It helps them with curriculum. It helps them set up everything they need to have a successful home child care environment and business. So I really encourage folks, if they're listening or know someone who is in the position that Representative Gomberg referred to, that is at home taking care of their children, thinking, I could do this as a business, I think, but I'm not sure where to start. I encourage them to reach out to our Child Care Resource and Referral Program here in Tillamook, talk with Eva, and learn a little bit about this shared services model and how it can help stand up a child care program more rapidly. I also want to share just quickly that the commissioners in our ARPA funding have supported this program. So we are excited to be a part of expanding childcare in Tillamook County. So I will leave it at that, but thank you for bringing it up. I really appreciate it, Representative Gomberg. It is a crucial piece of COVID recovery is to expand our childcare.
And there's good things going on there, so let's remember that. And I just want to finish this conversation where I started it, reminding folks, bring 4 kids into your home, and you can add, in round numbers, $2,000 to your income portfolio every single month.
It's a great thought. Appreciate that. Representative Gomberg, please continue on with anything else that you want to bring to us.
Well, here's one of the. Let's move to a lighter note, if I could, commissioners, if we've got a couple of minutes.
Absolutely.
I wrote a report earlier this week about state symbols. You know, we have all kinds of state symbols, and we create them for a variety of reasons. Part of our history, pride, our long-term vision, in order to support our economy. So, we have a state rock, we have a state gemstone, we have a state song, we have a state dance. But we've also got all kinds of other state symbols. For example, I'm sure all of you know what our state crustacean is. It's the Dungeness crab. What's our state tree? The Douglas fir. What's our state fish? The Chinook salmon. And of course, what is our state drink? Everybody say it together. Milk. Milk is our state drink. So earlier in the last legislative session, I had introduced a bill to create a state pet. And everybody's scratching their head saying, Gomberg, don't you have better things to do? Well, this is not the most important piece of legislation I'm working on, but it's an important piece of legislation. I had proposed naming the rescue dog or cat as the official state pet. And I did that because I thought it would be good for the pets to help them get adopted. I thought it would be good for the families that do those adoptions. And I also thought it would be good for taxpayers who, of course, are footing the bill for so many of our public shelter systems across the state, spending thousands and thousands of dollars to shelter, to feed, and provide health care and other support for animals that are in public care waiting for adoptions. That bill did not pass, but I'm planning to bring it back and hopefully add shelter rescue animals to the list of official state symbols and designations. And I think, as I said, it would be good for the animals, good for families, and also good for your public pocketbook. So I leave that with you with kind of a smile this morning, because those are some of the more lighthearted, whimsical, but still important things that we get a chance to work on at the state level.
Thank you for that, Representative Gomberg. It's always good to know what everyone is working on, and I know there are just a myriad of things that need attention in this state. So appreciate what you're doing very much. Any other questions for Representative Gomberg? And I just want to do another check here. Do we have any other Coastal Caucus members that might have joined us? Hearing none, we will move on to the Tillamook County Community Health Center. Marlene Putman and/or Ed Colson.
Well, good morning, Commissioner. It's Ed Colson here.
Good morning.
First off, I'd like to thank Eric over at Adventist Health for that update there. That was very informative, and we really appreciate it. To continue on with that, we'll go ahead with our community update. As a reminder as well, please continue to bring a mask with you to your appointments at our office. To protect employees and visitors, everyone 5 years of age and older is required to wear a mask or face covering in this healthcare setting. Children between 2 and 5 years of age are strongly encouraged to wear a mask or a face covering. So as was brought out earlier, our county data, our weekend case count from March 25th through the 27th was 5. Our 7-day case count from the 20th through the 26th was 14. 14-day case count was 31, and that ran from March 13th through March 26th. Total cases from March, all the way from the start through the 27th, are 41. Our total cases to date from March 2020, over 2 years ago, through the 27th of this month, 3,637. And throughout that time period, we did have 60 COVID-19 related deaths. Our total COVID-19 related hospitalizations were 139, and our active outbreaks per OHA are total of 12 under monitoring. Our 7-day test positivity rate was 4.6%. That ran from March 20th through the 26th. And as of March 27th, of those aged 18 years and older living in Tillamook County, 80.6% have initiated the COVID-19 vaccination and received at least one dose. 74.4% have completed their primary series, and 45.1% have received an extra dose of any COVID-19 vaccine in addition to completing their primary series. So just a couple of terms to stay up to date as we move forward through this pandemic here. If you have not received a COVID-19 vaccine, you are not vaccinated. You are fully vaccinated if it has been 2 weeks from receiving the single Johnson & Johnson vaccine, or 2 weeks from the completion of a Pfizer or Moderna vaccine. You are up to date if you have received a booster or completed the primary series of Pfizer or Moderna within the last 5 months, or the Johnson & Johnson vaccine within the last 2 months. You are not up to date if you are unvaccinated, completed the primary series of Moderna or Pfizer over 6 months ago and did not receive a booster, or completed the Johnson & Johnson vaccine over 2 months ago and are not boosted. So the reason why we bring those out is if proof of vaccination is required by an event or a business, they may have that type of terminology. So it helps to understand what the vaccine status definitions are. And some more information about that can be found on CDC's COVID-19 vaccine information page. Many may have heard that an additional booster dose requested by Pfizer and Moderna. As a reminder, changes in the COVID-19 vaccine authorization must first go to the Food and Drug Administration for emergency use authorization review. And then if approved, then the decision goes to the Advisory Committee on Immunization Practices, which is a panel of medical and public health experts convened by the CDC, who then make a recommendation at the federal level. And then from there, that comes down to the local state review, for which Oregon uses the Western States Scientific Safety Review Work Group. And if that work group, comprised of the states on the West Coast here, endorse it, then the Oregon Health Authority will update their standing orders and protocols for the Oregon vaccine providers then to begin administering the vaccine as per the change. COVID-19 testing and vaccines are available from most healthcare officers in Tillamook County, including at our main clinic on Pacific Avenue. It's 801 Pacific Avenue in Tillamook. Appointments are required for both testing and vaccinations. So please give us a call at 503-842-3900 to schedule. Once again, home test kits are available from community-based organizations in Tillamook County and through the Tillamook County Library branches for pickup. Federal government also made an additional 4 COVID-19 home test kits available for free mail delivery. So you can go ahead and visit www.covidtests.gov to order there. There is also antiviral oral medication that is available. So while COVID-19 vaccines are the best method for prevention, reducing disease spread, and reducing disease severity, if you do have a positive test, we do have those available as early treatment options. They must be started as early as 5 days from the date of the positive test, so please contact your healthcare provider or pharmacist as soon as possible for treatment options. More information is on our website, tillamookchc.org, or you can call 211. If you do have any other COVID-19 related questions or need additional support, please give our public health nurse line a call at 503-842-3940. And that's our community update report. I'll turn it back over to you, Commissioner Yamamoto.
Thank you for that report, Ed. Appreciate that very much. Just want to mention that, the mask requirement in most instances is no longer a requirement at this point, but I just happened to stop by the health clinic yesterday to pay a bill, and so of course I had to wear a mask going in, and masks are also necessary on any public transportation. So if you're going to the airport or even taking a bus, things of that nature, again, you're going to need to wear a mask. And even in the courthouse, where masks are no longer required, we do have people in the courthouse that for personal reasons are wearing a mask, and we have to be aware of that, and there's absolutely nothing wrong with that, especially if you are health compromised in any way or something like that. Wearing a mask is still one of your best defenses against this disease. So again, Ed, I want to thank you so much. Any questions for Ed Colson? Thank you, Ed. So let's go to the Nehalem Bay Health Center and Pharmacy. Normally we have Gail Nelson with us, but Gail has emailed me and said she's not going to be available for the next meeting or two. So with us this morning, I hope we have Leanne Hofheinz. Leanne.
You do. Thank you very much, sir.
Good morning.
As Commissioner Yamamoto mentioned, I am filling in for Gail Nelson, our CEO. I'm Leanne Hofheinz, the Communications Manager for Reinhardt Clinic, soon to be known as Nehalem Bay Health Center and Pharmacy. The clinic is continuing to provide COVID vaccines 2 days a week. We offer Pfizer and Moderna on Thursdays and pediatric Pfizers on Fridays for those aged 5 to 11. And of course, as needed throughout the week. Our panel manager actually keeps an eye on the patients coming in for the day and flags any who are eligible or overdue for booster doses or second doses. And so we try to make sure to capture those. But anyone who needs a vaccine is welcome to come in, and we'll make sure they get one. We still have masks and the N95 masks and at-home tests available at the clinic and pharmacy, free to anyone who needs them. And as others on this call have mentioned, masks are required at the Reinhardt Clinic and Pharmacy, and we have signs up at every location as people come into the building, so to make sure that they're aware of that. The other thing I want to talk about is Tillamook County Wellness Walking Groups are kicking off next week. Next Wednesday is National Walking Day, and there will be walking groups taking place throughout Tillamook County, and Reinhardt Clinic's Wellness Navigator is leading one of those walking groups in North County every Tuesday morning at 9 a.m. We'll be at a different location each week, from Rockaway Beach up to Manzanita. So if you're interested in joining us, everyone is welcome. Follow Reinhardt Clinic on Facebook at Reinhardt Clinic to see where we will be each week. I think that's all we have. Thank you very much.
Thank you, Leanne, for being here. Appreciate that. Any questions for Leanne? Let's go to the Tillamook Family Counseling Center. Do we have Frank Hanna Williams with us?
Good morning, Commissioners. This is Frank Hanna Williams, Director of Tillamook Family Counseling Center.
Good morning.
Good morning. Behavioral health services for Tillamook County residents. You can get information regarding services, appointments, by calling us at 503-842-8201. I'd like this. We're coming close to the end of the month of March here, which was Problem Gambling Awareness Month, and we've received a number of calls during the course of the month. Probably more calls this March than previous Marches, regarding questions regarding services that we have for problem gambling. I want to say that one of the calls that has come in fairly frequently has been questions regarding if I am a family member, can I be a part of any services that you provide? And what I want to say is that yes, the Oregon Health Authority provides support for family members. If you are a family member or a friend or a loved one who is not a person who has the challenges around the gambling, but you want to be able to talk about how it impacts you as a friend or family member, and that comes under the category of a needed service category. So if you are in that situation, you can please call us, and that is viewed as an important way in which we can provide services to you. So you do not have to be the person who has the challenge around the gambling specifically. So anyway, I wanted to share that and respond to the fact that we have received a number of calls and questions about this area. So as I said, Tillamook Family Counseling Center Behavioral Health Services for Tillamook County residents, 503-842-8201. And we'll take any questions if you have any.
Thank you so much for that report, Frank. Any questions for Frank Hanna-Williams? Thank you, Frank. Let's move on to the Sheriff's Office. Do we have Sheriff Brown with us this morning?
Good morning, Commissioner. I am here.
Yes, good morning.
Good morning. Just a couple of things I'd like to talk about. If most people follow our Facebook, they probably have seen this, but for those that do not get involved with Facebook, we did have an incident that we responded to up Highway 6 on Fox Creek Road. It was an ATV crash. Essentially, a motorcycle struck a vehicle that was driving down the road. Multiple deputies, Oregon State Police, Tillamook Fire, Tillamook Ambulance all responded. The subject was able to be removed from being entrapped under the vehicle and was life flighted out of the area with serious injuries. So that's just one of the bigger issues or bigger incidents that we dealt with this past week. It's a good time to remind everybody that if you are recreating in our forest area, to please be careful. Not all of our areas have great cell phone service, and so if you do get hurt, getting help up there may not happen as quickly as it would down in areas where cell phone coverage is strong. So definitely be careful. Pay attention around corners. Pay attention and just be as safe as you possibly can. That way, when you're recreating and enjoying our forested areas, you can continue to enjoy them rather than taking the risk of getting hurt. We do have the town hall meeting tomorrow for Highway 6. That's Mr. Gomberg, Representative Gomberg had mentioned that on behalf of Representative Weber. I just seeing how that's kind of coming up, and we just had a story about an NATV crash. It's worth mentioning that from this time last year compared to this time, the same chunk of time this year, basically January 1 until today, motor vehicle accidents are down, not by a huge number, but they are down. We are also seeing a trend in crashes that are the serious injury crashes seem to be going down as well. Our non-injury crashes are a little bit higher than they were last year. which of course we don't want anybody to crash, but if we are reducing or it seems as if the numbers are showing that serious injury crashes are starting to be reduced slightly. So that's really good news from my point of view. The other thing that I'd like to mention is that we should be seeing an opening in the sheriff's office for a records technician or a records clerk. It's something that we have had in the past, and we, due to staffing shortages that every police agency across the state and frankly across the nation are feeling, and quite honestly, it extends to virtually every other business, are struggling to find people wanting to work or who are ready to work. So we have had to be a little bit creative, and a records technician position is able to do some work that takes some of the workload off of deputies, which allows them to, complete project or take care of duties that are self-initiated, such as traffic stops, and get out there more rather than having to spend quite as much time either in the office or dealing with things like that. So if you have any interest in this type of a position, it would be on the criminal side, where you'd actually be in the front desk area, greeting public. You'd be helping with filing, records requests, a whole list of different things that are associated with that. That opening should be coming up fairly soon. So if you know anybody that is interested in it, or you yourself are interested in it, please go online and apply for that position. We definitely can use the help with all of our shortages that we're feeling right now. So with that, that's all I have for this morning, and I can take any questions.
Thank you so much, Sheriff. Do we have any questions for Sheriff Brown? So, Sheriff, I just want to mention that, in PC this weekend, things were pretty busy. This is going to be, I just know it is, this is going to be another one of those busy seasons here on the Oregon coast for our lovely tourists. So we're ramping up and going to do the best we can to make sure that everyone stays safe out there. So, again, this is just par for the course right now. People are still maybe a little afraid to fly, so we just think that this is going to be a busy summer, so everyone just needs to be prepared.
Agreed. Definitely agreed.
Thank you, Sheriff. Any other comments or questions for the Sheriff? Let's go to emergency management. Randy Thorpe is here today, but he's in classes all week. And so I believe we have Gordon McCraw with us. Gordon.
Yeah, good morning. Yeah, he contacted me yesterday and said he's doing some required FEMA training on Zoom the next few days. So I know he's excited to be doing that. All I can offer you today, with not much happening in the world of emergency management, is maybe an update on the weather, which looks like we're going to be still stuck in the on-again, off-again pattern that we've had the last week, which gives us periods of showers as weak systems pass through. Today you see the stratus or marine layer out there, but it'll burn off later today. But you'll also see some high clouds moving in, which would be ahead or your warning that the next front is on the way. That'll bring scattered showers late tonight, but more showers with the post-frontal showers tomorrow. It'll also be pulling the snow level down to between 2,500 and 3,000 feet. So the higher Coast Range mountains could be seeing some light snow again, which is good. Friday and most of Saturday will be dry, but with the upper level flow becoming flatter zonal west to east, we'll see disturbances that could ride across that and give us an increasing chance of rain or rain showers Friday on through the weekend. It looks like a dying front will give us a slight chance of rain Saturday night, with a little better chance on Sunday. Then a stronger trough of low pressure is going to drop down, and exactly how much rain we're going to get is questionable, because the models don't always agree, and they don't at this time because it's so far out and it's kind of getting to be that time of the year. So we'll keep an eye on just how much rain and exactly pinpoint who and when or where later in the week maybe. The temperatures, if you notice, they've been remaining in the low to mid 50s and the lows staying in the low 40s, although with this front coming through, it'll be a little cooler by Thursday night. And then, like I said, with the next system coming in, it'll pull the snow levels back up and we get ready for the next front. And that's really all I have. So thank you very much.
Thank you for that, Gordon. Appreciate you being here. So we're up to item number 9, Board of Commissioners. We do have a brief piece of business that we need to conduct here. Very briefly, what we're doing, this is a board order basically appointing me to serve as a voting member of the AOC Federal Land Management Subcommittee of the Association of Oregon Counties. We've got a meeting coming up on Thursday, and in order for me to be able to cast ballots on behalf of Tillamook County, we need this board order signed. So that's what it's about. Commissioner Scar, any questions at all?
No questions. I appreciate your willingness to serve on this Federal Land Management Subcommittee. And if you are ready, I have a motion for you.
Thank you.
So I would move to authorize Tillamook County Commissioner David Yamamoto to serve as a voting member of the Board of Directors for AOC Federal Land Management Subcommittee and to cast votes on behalf of the Tillamook County Board of Commissioners.
Thank you. I appreciate that. And I would second the motion. Any further discussion? Hearing none, I'll call for the vote. All those in favor signify by saying aye.
Aye.
Aye. Thank you. Thank you for that. That's very quick. So back into the Board of Commissioners reports. Commissioner Scar.
Perfect. Thank you. I'm going to be, I think, the third person, or maybe the fourth on this call, to mention the Safety on 6 virtual town hall. And I'm going to do that because I want to let people know how to join. You can find the link on Facebook. It is a link to the Commissioners Teams meeting platform. We're working with Jesse to host this. If you would like to call in, the number is 971-254-3149. Access code 736-023-979#. It is at 6 p.m. on the 30th. You can also get that information off of our website. If you go to the county's main webpage, on the bottom left corner, you will see a link to our calendar. And on the calendar on Wednesday the 30th, you can click on the town hall and it will provide the same information to you that I just provided. The calendar is really a very helpful tool. I'm going to refer you back to it for a couple of other things during my conversation here. But that is the Safety on 6 town hall, and it will be, the commissioners will be in attendance. I know that Representative Weber will be there. We will have representatives from ODOT. So it's just going to be an opportunity to follow up on what has happened since the first town hall, which was held, gosh, I should have that date in front of me, and I don't, but a few months ago. I think there's been a lot of activity and a lot of interest, and a lot of resources have been applied, and I think this is a great opportunity to review what's been done and to hear what will come next. So I hope to hear and see a lot of you at that town hall meeting. The second thing I want to talk about are the budget workshops that are coming up. And again, I'm going to refer you to that calendar. We have budget workshops in April. They are on April 12th, 13th, and 14th. There are links on the calendar that you can click on that will tell you the hours of those meetings, the locations, and also you can follow through to a link of the posted budget that the treasurer has put up for us. And if you are interested, if you have questions related to that, you're obviously welcome to reach out to the treasurer. She can answer questions for you. Additionally, you can reach out to your commissioners. The budget is large and complex, to say the least. That's why there will be 3 days of budget hearings. And I recognize that not everyone has that kind of time, but please feel free to reach out if you have questions about specific departments or budgets or even the overall. And we'll all do our best to help you kind of understand how this all goes together, because it is complex. But again, I want to just refer you back to that calendar. It's the easiest place, I think, to grab those documents. I believe there will also be an announcement in the paper in the sort of legal section about those budget workshops. So we invite you to get involved and to understand your county budget and know where the taxes that you pay that make it to the county, what do we do with those on your behalf? So invite people to participate. Okay, the third thing I want to talk about is the ARPA awards. We've been talking about this. We received directly to the county $5.2 million in American Rescue Plan Act funding, and we went through a process including a solicitation of community projects to determine the best way for our county to use those funds, and have now made those decisions, and those awards have been formally announced. Again, I'm going to direct you back to the calendar. On March the 23rd, at the commissioners meeting, we approved the list of awards. So if you go to the calendar, you can attach to the board package there, and you can see the awards that were given. Additionally, you can go on the front page where it says agenda and minutes, and you can get into the commissioner's agenda from March 23rd, which will allow you to get into the board packet and see that announcement. I am going to talk about a little bit about the process that we went through for these ARPA awards. I know there's a lot of interest in the community to know how we chose, what we chose, and why we chose what we chose. So I want to let folks know that we went through a fairly intense process with this funding. We worked with Echo Northwest, which is an economic consulting firm, to help us with this. They did some background research for us to help us understand the impacts of COVID in our community so that we could really look and say, where are the greatest issues that are in need of support and funding, and how does it fit in with the CARES Act funding that had already been previously awarded in our community, as well as looking at the payroll protection loans that were awarded in our community, the loans that went out in our community through the federal government, just really looking at what was the complete package of money that came to our community and where did the gaps continue to exist, as well as looking at the ARPA Treasury guidance, which was over 400 pages, to determine what was allowable for these funds. So it was a very complex and comprehensive process that we used to determine what we would spend these funds on. These are a one-time payment to us. We are not going to see $5.2 million again. So we tried to be very cognizant of that and spend it on capital items and things that would not require ongoing support into the future, such as added positions, because we will not have this money going into the future. We also looked at what can it pay for that no other funds that we have access to can really pay for. That was a key factor in our decisions. We also looked at what was ready. These funds have to be spent by 2024, and that puts us in a position that we really couldn't award funds to projects that were a great idea, but not yet fully vetted or fully fleshed out and ready to go. So there were a lot of factors in it. So I do want to talk quickly about the top three because I have had lots of questions in the community. The first one is, it says Tillamook County Courthouse Annex. And people say, well, why are you doing that? What's with the annex? And I think it's important that people understand that one of the requirements of the county is that we provide adequate space for circuit court. And we have, for many years, been out of compliance, if you will, with that mandate from the state. We have not provided what's considered adequate and safe space for circuit court. And we have been, as commissioners, and certainly commissioners before my time, working on this, trying to find a solution. What we have come to at this point, because there is a huge backlog of cases that need to be tried, and there is a requirement for a speedy trial, which means that people who do not get a speedy trial may be off on a technicality, which we don't want to see that happen. So the commissioners are giving up our meeting room to circuit court. It will become a permanent courtroom, which will be large enough for the trials to continue and move ahead. And ideally, we'll have our fingers crossed that that speedy trial will be met for everyone who is in need of a trial. But what that means for the commissioners is we are giving up our meeting room, and ultimately we'll give up our offices as well because they adjoin to that meeting room. So the money that is set aside for the courthouse annex is money that will match state money in order for us to find another location for the commissioners. So it may seem that the county has awarded ourselves a large grant, but I just remind people that any money that goes to the county is in the service of everyone who is a resident here in our county. And in this one in particular, we are meeting our mandate to provide courthouse space to the circuit court. So that's the biggest award at $995,000, and that is to meet our mandate of circuit court. The second one is titled Kilch's House, and that has created a lot of confusion in the community, and I want to clear that one up as well. So there are flood mitigation funds that are pending through FEMA that are intended to address the drainage issues off of the fairgrounds adjoining the college. And the reason that it's titled Kilch's House is in 2015, when we had an extreme storm here that didn't cause the rivers to flood, but surface water just was overly abundant, and Kilch's House flooded. So when it came time to do the mitigation grant applications, Kilch's House was the affected property for these mitigation funds. And as a result, Kilch's House is in the title of this. And it's unfortunate, we should have put it as Kilch's House Neighborhood Flood Mitigation, because that's what it is. It is not, in fact, related to Kilch's House at all. It is a county public works project to change the drainage out in that part of the town that would move water away from that big lake that forms there right by the college, and it would move it actually northward and down underneath the road and out to a better drainage area that would keep that neighborhood from flooding. The neighborhood has consistently had issues. It's called Kilch's House because that was what flooded in 2015. It is $640,000. It is a match to, I believe, about $1.6 million of FEMA. So this is money that we didn't have any other place that we could get, but we don't want to lose the opportunity of those FEMA funds. So again, an important project, something that didn't have another funding source. It is ready to go. All of the engineering has been done. We're just waiting for the ability to find match, and here it is. So we are excited to deal with that drainage issue that has been there for many, many years. The third highest one, it says housing opportunities, and this is an important one. Doesn't matter who we ask in the community what the greatest issue is, we continue to hear housing for our workforce. That $400,000 will go to the County Housing Commission, who will then accept applications from housing projects, and will use that to subsidize development. So there were a number of housing projects that applied directly to this ARPA fund, and we made the decision to give the $400,000 to the Housing Commission and let them use a process they have been developing for approximately a year to give those funds away. So those were the three top ones. The fourth one is a reserve. COVID is not over. And as we talked about already this morning, we are extremely hopeful that the numbers that we see decreasing continue to decrease, and that we can, at some point in the near future, declare this endemic and really feel like we're not waiting for another surge that will stretch our hospital capacity in those pieces. So we have set aside $371,250 as a reserve for the county, and that is a reserve for the community. It is an opportunity for us to say, between now and 2024, is there something that happens that we need to be ready and able to provide support to? So I encourage everyone who's interested, please go ahead and go to the county, either the calendar or the agendas and minutes tab. Take a look at the rest of the awards. If you have any questions about these awards, I encourage you to reach out to us as commissioners. We are happy to talk to you about it. It was, like I said, an in-depth and complete process, and there were $45.5 million in requests from 110 projects, and we were able to award 33 projects with a total of $4.738762 million, because we had already applied some funds to urgent projects. So it was, again, a big deal. So if you have questions, please don't hesitate to reach out to your commissioners. We'd be happy to talk with you about the process and how we made our choices. So with that, I will turn it over to you, Mr. Chair. Thank you.
Thank you, Commissioner. I appreciate that so much. That was a very comprehensive report, and it's amazing how difficult it is to spend money. I mean, we spent untold hours together and individually trying to figure out, the best spots for this money, and it's amazing how difficult it is. It really is. So I know I keep talking about the same thing, so I just want to give everyone a brief update on things that I and the Board of Commissioners office is working on, first and foremost in my mind, is the Lynn County class action lawsuit, a $1.065 billion award, and gaining interest at $262,000 every day. And we continue to work on that. Tied to that is, as I mentioned last week, the federal agencies just released the draft EIS, Environmental Impact Statement, for the Oregon Department of Forestry Habitat Conservation Plan, which they're trying to move through. To me, this is very troubling in not meeting the goals of the Council of Forest Trust Land Counties or the original goals stated in the business case analysis provided by the Department of Forestry 3 years ago. So that one is also very troubling, and we're going to be dealing with the Board of Forestry coming up on that issue. Kind of tied to that tangentially is the NOAA Fisheries FEMA biological opinion, and you've heard me talk about that. I've been working on this for 8 years, and the first 7 years was getting absolutely nowhere. But now within the past year, all of a sudden, I see a light at the end of the tunnel. And so we continue to work on this vigorously along with our national partners, NACO, the National Association of Counties. And it is my hope that we're going to see some movement on this very shortly. So keep your fingers crossed there. Rachel Haggerty has been working diligently on the communication system in Tillamook County, and we appreciate that very much. And this is another big project, roughly $17 million project. If you talk to any of our fire districts or the sheriff's office or the police departments, public works, ambulance service, they all rely on the communication system that the county is responsible for. Got so many areas where service can and should be better. This is a life, health, safety issue. So we're diligently looking for money to complete this system. The last thing I'm working on, again, diligently is broadband. We need high-speed internet for everyone in Tillamook County. The best economic development tool anybody can find is high-speed internet. And so that's something that we're working on to make sure not only the school kids have the internet services that they need, but businesses and people in general. So just a very brief rundown of things that we're working on here in the Commissioner's office. So let's move on. So let's go to the city of Manzanita. Mike Scott. Mike, are you with us?
Good morning. We don't have anything to report this morning. Thank you.
Thank you for being here, Mike. Appreciate it. City of Nehalem, Melissa Thompson-Kiefer or anyone else from Nehalem? How about the city of Wheeler? Doug Honeycutt or anyone from the city? How about Rockaway Beach? Sue Wilson or anyone else from the city of Rockaway? Garibaldi, do we have Tim Hall with us? How about Bay City? David McCall. City of Tillamook, Nathan George.
Good morning, Commissioner. This is Nathan.
Yeah, good morning.
Good morning. Yes, I do have several things. Thank you very much, and thank you for allowing me to not participate as I was out on spring break last week.
Understand.
Thank you. The City of Tillamook would like to thank the Tillamook County and our Tillamook County Commissioners for their $200,000 grant to help the city update the wastewater master plan. We truly appreciate it. This was approved last week at the Commissioners' Wednesday board meeting. This is a critical project that needs to be done in order to identify and fix many issues with the city's wastewater collection system on the east side of the city, specifically from Miller Avenue and east. This funding will allow the city to get work started sooner and done sooner. This is critical in order to provide the capacity for growth in those areas that the city provides wastewater services. There are multiple developers and property owners that have projects planned, and the city wants to really partner with our community to help provide this growth. So we are very, very, very grateful. And if anybody has questions, they can contact the city about the plans that we're working on. The sewer project on Grove Avenue is still in progress. Public Works Department will be setting a manhole at the intersection of 5th Street and Grove Avenue today. This will affect traffic flow for the next few days. The sidewalk replacement project that is on 2nd Street between Main Street and Ivy Avenue will be closed today while construction crews pave the new sidewalk. and that is a Tillamook Urban Renewal Agency funded project. The city received grant funding for ADA sidewalk construction repaving for 5th Street on the west side of the city. This is last year or earlier, and possibly before I came. But the city's applied for an extension of the funding in order to complete the project by next summer. The city's hope is that residents will sign up for the sewer and water lateral warranty program and get any lateral lines fixed so the road will not need to be torn up after the new paving. So along with that announcement, the city again encourages anyone to seriously consider the the Service Line Warranties of America program. And this is what I've talked about each week almost, to provide warranties to property owners for sewer, water, and indoor plumbing. It is less than $10 a month for each one of those services individually. It covers up to $8,500 in sewer lateral line repairs and water lateral line repairs, and if you get the indoor one, wall-to-wall plumbing is $3,000. And these service calls are unlimited. You can opt out anytime. So this truly is a real service, and the city has partnered with Service Line Warranties of America to provide this service. Please contact the city with any questions. You should be also getting brochures in the mail. On Wednesday, April 6th, 2022, that's next Wednesday, the Tillamook Police Department will be assisting in conducting a mock traffic crash at the turnaround area in the front of the Tillamook High School, located at 2605 12th Street, as part of the Every 15 Minutes program. 12th Street in front of the school will be congested and busier than normal from the 2:40 until 3:30 during the mock crash. We ask everyone to please use alternate routes during this time. This event is being sponsored by the Tillamook Police Department, Tillamook County Sheriff's Office, the School District, and TLC Fiber Federal Credit Union, Burdens Towing, and other numerous organizations. This weekend in the early hours, a Tillamook Police Department officer responded outside the city to assist deputies with the Sheriff's Office as they were attempting to arrest a combative suspect for court violation. During the arrest, an officer suffered an injury to his hand and was treated on the scene. And the members of the Tillamook Police Department and the city want to say thank you and say we really appreciate the commitment of Sheriff Brown and his team as they foster a great work relationship with our police department especially, and with the city. And lastly, the next regular council meeting will be on Monday, April 4th, this next Monday at 7 p.m. City Hall. We will also be having a work session at 6 p.m. that will cover many topics. We encourage anyone that wants to be informed about their local government to attend, and you can also always contact us for information. That's all I have, Commissioner. Thank you.
Thank you, Nathan. Appreciate you being here. Finally, last but certainly not least, the South County, Doug Olson. Doug, are you with us?
I am. Good morning, Commissioner.
Good morning.
Just a couple of things. It was mentioned that spring break is over, but that's not really true. My years in business indicates that when Oregon is done, then Washington comes along, and so does Idaho. So there's several more weeks of a lot of people coming to our part of the world, and that's good and bad, depending on your point of view. More traffic, but also more money and good for our businesses. So double-edged sword, sort of. The only other thing I'll mention is a week from today, our Chamber of Commerce, the Pacific City Nestucca Valley Chamber, will meet in person for the first time in close to a year, I guess. And it will be at the Kiawanda Community Center, 12 noon, exactly a week from today. I believe that's the 5th of April. And we'll have our regular lunch and reports from people in the legislature and others. Our featured speaker will be Dr. Ross Tomlin, who is the president of Tillamook Bay Community College. And he's going to speak to the bond measure that will be before voters, which will provide a new facility for a nursing school and then the nursing program itself, something we don't have in Tillamook County, but which is desperately needed. And then later that week, next week on the 7th, we'll have a candidates forum at the Kiawanda Community Center, opening the doors at 6 o'clock. We'll have candidates for the Oregon legislature, including House District 32 and the Senate District 16, which now cover all of Tillamook County. As Representative Gomberg pointed out, the boundaries have changed. We'll also have the two individuals for the county commission, one position open, and then some uncontested races, including the and attorney. And then we'll also have people talking about the money measures as well. So anyone who wants to know more about the candidates, ask them questions or ask about the financial measures, that's a pretty good time. In addition to coming and doing all that, you can get cookies and coffee and make an evening of it. So Thursday the 7th at the Kiwanis Community Center, an important community event for all of us here in South County. That's it this morning. Thank you, Commissioner.
Thank you, Doug. Appreciate it very much. Anyone else for the good of the order? Hearing nothing. I want to thank KTIL in particular for broadcasting and everyone for attending this meeting. Time being 9:10 a.m., we will adjourn this community call. Thank you, everyone.